What if the worst part of being sick wasn't the illness itself? What if it was the looks, the whispers, the silence? Every day, millions battle not just disease, but judgment, isolation, and shame. Why? Because society still treats illness like a weakness, a punishment, a secret. It's time to stand up, speak out, and break the silence. Because healing isn't just medical, it's social. This is how we end the stigma. Stick around, share this, be part of the movement. Let's get something straight. Stigma isn't just bias. It's rejection, exclusion, judgment. It's fear, wrapped in silence. Stigma says, you're not like us. You're broken. You don't belong here. And when you're sick, whether it's mental illness, HIV, cancer, or a chronic condition, those words don't just sting. They wound deeply. Stigma makes people feel ashamed for something they never chose. It whispers, hide who you are. Don't talk about it. You're the problem. But here's the truth. Stigma lies. No one deserves to feel unsafe, unwanted, unseen, just because they're fighting a battle you can't see. You might think stigma only targets certain people, but the truth is, it doesn't discriminate. It creeps into hospitals, schools, offices, even dinner tables. People with mental illness often suffer twice. Once from their condition, and again from the shame society piles on top of it. We call them unstable, crazy, dangerous, instead of what they really are, people in pain, who need compassion. People with HIV, AIDS, cancer, or other visible diseases are treated like they're contagious, or worse, like they're to blame. They hear the whispers, see the stares, feel the fear, as if the diagnosis makes them untouchable. Those with disabilities or chronic conditions are dismissed, underestimated, or outright excluded. Not because of what they can't do, but because of what people assume they can't. The problem isn't their condition, it's our perception. And let's not forget the caregivers and families. They carry invisible weight, often without support, understanding, or relief. Stigma doesn't just isolate the sick, it isolates everyone who dares to stand beside them. So who faces stigma? Your neighbor, your friend, your coworker, your own family, maybe even you. Stigma is not just one thing. It wears many faces and touches many lives. First, there's public stigma, the most visible kind. It's the looks, the labels, the loud opinions and the quiet rejections. You're unstable. She's dangerous. He must have done something to deserve it. It's prejudice disguised as concern, and it pushes people to the margins of society. Then there's self-stigma, maybe the cruelest of all. It's when we believe the lies we've been told, and turn shame inward. It sounds like, I'm broken. I'm a burden. No one will ever love me like this. Stigma makes people hide, not just from others, but from themselves. Institutional stigma is built into the systems we trust. It's laws, policies, and procedures that discriminate, often quietly. A job applicant dismissed because of a diagnosis. A student with ADHD labeled a problem child. A cancer patient denied insurance coverage. This isn't just unfair, it's dangerous. And then, there's courtesy stigma. Yes, even love can carry a cost. This is the stigma that clings to caregivers, partners, parents, and siblings, just for standing beside someone who's ill. They too are avoided, judged, and left out. Not because they're sick, but because someone they love is. Stigma doesn't just target the ill. It surrounds them, like a shadow, pulling in everyone close. It silences. It isolates. And worst of all, it stops people from healing. Stigma isn't just a word. It's not just an attitude or an awkward silence. Stigma has real consequences, the kind that destroy lives quietly and quickly. Let's begin with mental breakdowns from shame. For many, the pressure to hide their illness becomes unbearable. They smile in public and collapse in private. They carry invisible pain until it cracks open into anxiety, panic, depression, breakdown. Not because they're weak, but because the weight of silence is too much. Skipped medical care translates to worse health. Others stop seeking care completely, afraid of being judged, labeled, or misunderstood. They cancel appointments, hide symptoms, wait until it's too late. And so, what could have been treated becomes irreversible, not because of the illness, but because of the shame around it. Next, lost jobs, lost dignity. Stigma shows up in the workplace too. When someone discloses a condition, instead of support, they're met with suspicion. Will they be reliable? Can they handle pressure? Just like that, opportunities disappear. Careers stall. Dignity crumbles. We will now focus on social isolation and rejection. And perhaps worst of all, stigma pushes people away from everyone they love. Friends stop calling. Invitations stop coming. Even family starts to withdraw. Isolation becomes the new normal, and the loneliness. It's devastating. This isn't just sad. It's deadly. Stigma kills hope. It kills connection. And too often, it kills people. And that's why it must end. Now. If stigma is so harmful, so damaging, then why does it still exist? The truth is, stigma isn't born from cruelty alone. It's born from confusion, fear, and deeply embedded myths. 1. Lack of knowledge. In many places, people simply don't understand illness. They've never been taught what it is, or what it isn't. Mental illness is mistaken for weakness. Epilepsy is still called a curse. Cancer is seen as a death sentence. And in the absence of truth, stigma takes root. 2. Fear of contagion. Stigma is also fueled by fear, especially the fear of catching something. Even when there's no medical risk at all, people avoid those living with HIV, leprosy, tuberculosis. Not because they're dangerous, but because of outdated fears. Fear turns into distance. Distance turns into silence. Silence turns into shame. 3. Harmful cultural beliefs. In some cultures, illness is seen as punishment, a result of sin, bad karma, or spiritual weakness. Families hide their sick relatives out of embarrassment. People are told to pray harder instead of getting help. When culture blames the victim, stigma is passed down through generations like a curse. 4. Stereotypes and media misrepresentation. And finally, the media. TV shows, movies, and social platforms often get it wrong. They show people with mental illness as dangerous, people with HIV as reckless, people with disabilities as helpless. These images don't educate, they exaggerate. They reduce real people into caricatures. And society believes the lie. So why does stigma exist? Because we let myths speak louder than facts. Because we're more afraid of what we don't understand than of what happens when we stay ignorant. But once we name the root, we can pull it out and replace it with truth, empathy, and connection. Understanding is the antidote to stigma. We've seen the damage stigma causes. The silence, the shame, the isolation. But here's the truth that changes everything. It doesn't have to be this way. Stigma isn't permanent. It isn't natural. It's something we created. And that means we can end it together. This is not one person's fight. This is our fight, as a society, as a people, as human beings. Change doesn't happen alone. It happens together. Through awareness, by learning the truth, and sharing it, by educating others, by refusing to let misinformation shape our minds. Awareness replaces ignorance. It opens eyes. Through empathy, by choosing to listen instead of judge, to ask instead of assume, to see the person, not the illness. Empathy softens hearts. It builds bridges. Through action, real change demands more than kind thoughts. It takes action. Speak out when others stay silent. Challenge harmful systems. Support those living with illness. Not out of pity, but out of justice. Action turns empathy into impact. We have the tools. We have the power. What we need now is the will. Because the moment we stand with the sick is the moment stigma begins to fall. Stigma is a choice. So is compassion. Stigma doesn't disappear on its own. It fades only when people, like you, decide to confront it. And the first step in fighting stigma is the most powerful of all. Educate to empower. Education is the antidote to ignorance. When people understand the truth about illness, what causes it, how it works, and how to support those affected, fear starts to fade. And in its place, empathy grows. Teach the truth. Everywhere. Don't wait for a crisis to start the conversation. Talk about illness in your classrooms, your places of worship, your WhatsApp groups, your TikTok feeds, your workplace training sessions. Because the more we talk, the more we normalize. Make stigma-free conversations normal. Imagine a world where saying, "I take antidepressants" is as unremarkable as saying, "I take insulin." Where someone can say, "I have cancer," without being pitied or avoided. That world is possible, but only if we make these conversations common, safe, and stigma-free. It starts with a question, a story, a moment of honesty. And it spreads with every person who chooses to learn, speak up, and educate others. Knowledge breaks the cycle. Education saves lives. Sometimes, stigma hides in the words we use without even realizing it. One careless phrase can shame someone silently. But the right words, they can build dignity, trust, respect. Say, "person with depression," not "crazy person." Depression is a medical condition, not an identity, not an insult. Saying, "person with depression," puts the person first. It shows they are more than their diagnosis. But calling someone crazy, that's not just disrespectful, it reinforces centuries of misunderstanding and shame. Say, "living with HIV," not "HIV victim." People living with HIV are just that. Living, thriving, managing their health. Calling him a victim takes away their agency. It paints them as helpless, when in reality, many are strong advocates, parents, professionals. Words matter. They shape perception. Say, "person with a disability," not handicapped. Handicapped is outdated and often loaded with pity or exclusion. Saying, "person with a disability," is respectful. It acknowledges the person first, and their disability as just one part of their life. It invites inclusion, not limitation. This isn't about being politically correct. It's about being human. When we change the way we speak, we change the way we think. And when we change the way we think, we change the world around us. Words can hurt. Words can heal. Choose wisely. One of the most powerful ways to fight stigma is to let the people who live with illness speak. Not through statistics, Not through textbook definitions, but through their stories. Let those living with illness speak. When someone speaks their truth, it shatters stereotypes. It puts a human face to conditions people only read about. It turns them from a label into a person. Use vlogs, podcasts, and interviews. Social media isn't just for entertainment. It's a tool for empathy. A 2-minute video can do more than a 200-page report. When people tell their stories with courage, others begin to listen and understand. People believe what they see and feel. A person crying in a hospital room. A mother laughing while navigating life with cancer. A teenager explaining how ADHD affects his friendships. These moments don't need statistics. They need a screen and an open heart. Because when we see people's reality, we feel their humanity. Every person living with illness has a story that deserves to be heard. Not just the pain, but the strength, the resilience, the joy, the growth. When someone says, "I'm more than my diagnosis," they're not just asking to be seen, they're inviting you to stand beside them. So if you have a platform, use it. If you have a story, share it. And if you have ears, listen. Real stories break silence. Real stories break stigma. For someone living with illness, the world can often feel unsafe. Judgment lurks in whispers. Isolation creeps into silence. And stigma turns even familiar places into emotional minefields. But there's something powerful that can begin to heal all that. Safe spaces. Community support groups. These are spaces where no one has to explain or defend their illness. Where being vulnerable is met with kindness, not shame. Support groups give people the chance to be seen, heard, and understood. They remind each person, you're not alone. Online forums for peer connection. In the digital age, connection knows no borders. Online spaces allow people, especially those isolated by illness, to find their tribe. It could be a Facebook group for cancer survivors, a Discord chat for neurodivergent teens, or a subreddit for caregivers. These aren't just forums, they're lifelines, faith-based or cultural inclusivity centers. Spiritual and cultural communities can be either healing or harmful. When they welcome everyone, regardless of illness, they become sanctuaries. Spaces that blend tradition with compassion can uplift the soul as much as the body. Because no one should have to choose between their health and their heritage. Safe space equals healing space. Stigma makes people shrink into silence. Safe spaces give them room to breathe and grow. When a space feels safe, healing happens faster. Hope returns. Strength builds. Lives begin to flourish again. So whether it's a living room, a church hall, a Zoom call, or a school club, we all have the power to create these spaces. Places where people can drop the mask and just be themselves. Healing begins with feeling safe. Ending stigma isn't just about governments or global campaigns. It's about you, right where you are. In your school, your home, your workplace, your place of worship. You don't need a title or a microphone to make a difference. You just need the courage to be a community champion. You can lead the change. Champions aren't always the loudest in the room. They're the ones who take action, even when it's hard. You can lead by example. One conversation, one correction, one moment of truth at a time. Educate your circle. Talk to your friends, your co-workers, your community groups. Tell the truth about illness. Correct the myths. Share stories. Post resources. Because when you speak up, others learn. And when others learn, stigma starts to fall. Speak out when you hear stigma. That offhand joke. That careless label. That silent shrug. They all feed the cycle of shame. But one voice, your voice, can interrupt that cycle. Say something, kindly, firmly, clearly, because silence allows stigma to grow. But speaking up, that's where change begins. Celebrate resilience, not pity. People living with illness don't need pity. They need respect. Don't define them by what they've lost. Celebrate what they've overcome. Share their victories. Highlight their courage. Amplify their voices, not their struggles alone. You have influence, more than you know. With every post, every word, every stand you take, you can rewrite the story society tells about illness. You don't have to be perfect. You just have to show up and care. Champions aren't born, they rise, one choice at a time. You don't need a stage to change the world. Because today, the biggest influence comes from the screen in your hand. Social media isn't just entertainment. It's a platform for truth, a megaphone for empathy, and a weapon against stigma. Use TikTok, YouTube, Instagram to do the following. Every post, every reel, every share is a chance to educate. 1. To inspire, to connect. 2. Bust myths. Start a video with, "You've probably heard this lie." Then drop the truth. From mental illness to invisible conditions, let's replace rumor with reality. One viral fact at a time. 3. Share truths. People trust people, so don't underestimate the power of saying, "This is what it's really like to live with this." Real voices, real faces, real stories. That's how you change perception and hearts. Call out stereotypes in film and TV. Too often, media shows illness as weakness, madness, or tragedy. Call it out, challenge it, start conversations about how we should be representing the sick as whole, complex, powerful human beings. Make compassion go viral. Don't just go viral for views. Go viral for values. Let your compassion echo. Let your content uplift. Let your message remind the world. Empathy is powerful. Stigma is not. Whether you have 10 followers or 10,000, your voice matters. So pick up your phone, open your camera, and use your feed to feed compassion. Because in a world full of noise, let yours be the sound of truth, respect, and change. Make your content count. Make your compassion contagious. Healthcare should be the safest place for anyone who is sick. But for millions, it's not. Too often, stigma walks into the exam room before the patient ever does. Bias isn't just a social problem. It's a medical one. And if we truly want to end stigma, we have to start where healing begins, in healthcare. Train doctors in empathy. Medical degrees teach science, but they must also teach humanity. Doctors and nurses need to see the person, not just the diagnosis. Empathy isn't extra, it's essential. It builds trust, improves outcomes, and reminds patients, you are not a burden. Make clinics stigma-free zones. Every hospital, clinic, and care center should feel like a place of safety, not judgment. That means no eye rolls when someone talks about mental illness. No assumptions about someone with HIV. No dismissing someone's pain because of their gender, race, weight, or condition. Stigma has no place in places of healing. Protect patient privacy. Stigma thrives on exposure, on gossip, on carelessness. When a patient opens up about something deeply personal, whether it's cancer, a psychiatric condition, or a chronic disease, they deserve privacy. Not because they're ashamed, but because they should be able to choose how and when their story is shared. Dignity begins with discretion. Healing should never come with shame. Stigma adds a second wound. Emotional, invisible, but just as real. It can stop people from seeking care. It can delay diagnoses. It can cost lives. Every human being deserves care that heals their body without harming their spirit. It's time to rebuild trust. To retrain hearts as well as hands. To make our healthcare system a place where healing comes with hope, not humiliation. Because when care is compassionate, everyone gets better. Fix the bias. Free the care. End the stigma. Real change doesn't happen to a community. It happens through it. And when it comes to ending stigma, the people living with illness, those who've survived the silence, the shame, and the system, must be at the center of the movement. Not as symbols, not as subjects, but as leaders. Educate them about their rights. Knowledge is power, and for those navigating illness, knowing your rights is a first step to reclaiming control. The right to privacy, the right to access care without discrimination, the right to be treated with respect. Always. No one can advocate for themselves if they don't know what they're entitled to. Teach advocacy skills. Give people the tools to speak up, to write to leaders, share their story, challenge injustice, and demand better. Advocacy isn't just public speaking. It's learning how to stand up, even when your voice shakes. Let's turn lived experience into leadership. Promote peer mentors. There's something uniquely healing about hearing, "I've been there too." Peer mentors can break isolation, offer strength, and remind others that recovery and revolution are possible. When someone who's walked the path lights the way for someone just beginning, community is born. Don't just fight for them. Fight with them. Solidarity means showing up, not as a savior, but as a partner. Because people who are sick are not weak. They are powerful, capable, and worthy of being heard. So don't speak over them. Don't speak for them. Stand beside them. Learn from them. Amplify them. Empowerment is the antidote to stigma. And when those affected most lead the charge, stigma doesn't stand a chance. Support doesn't mean taking over. It means lifting up. Changing stigma isn't a sprint. It's a marathon. It takes more than passion. It takes persistence. It takes tracking the impact of what we're doing and refining it as we go. Survey public attitudes. Do people in your school, workplace, or community still believe harmful myths? Do they know how to support someone with an illness? The only way to know if we're moving the needle is to measure it. Send out anonymous surveys. Hold feedback sessions. Ask the hard questions. Then listen. Collect real stories. Behind every statistic is a human story. A lived experience. A voice that deserves to be heard. By gathering and sharing stories, we not only show why stigma hurts, we reveal how we can heal. Stories don't just track change. They inspire it. Adjust your approach. If something's not working, change it. Be flexible. Be responsive. Be real. The fight against stigma is not about perfection. It's about progress. Even if it's one step at a time. Change takes time, but silence takes lives. We may not dismantle stigma overnight, but every moment we choose action over apathy, every time we speak instead of staying silent, we save lives. Silence has cost too much, for too long. Now is the time to push forward and keep going. Track your progress. Celebrate your wins. Learn from your losses. And never stop moving, because change is coming, and you are part of it. Progress is the proof. Persistence is the power. What if we saw illness not as a weakness, but as part of being human? What if we met pain with presence, and fear with understanding? What if we stopped whispering behind backs, and started standing side by side? What if, instead of judgment, we offered grace? Instead of silence, we chose solidarity. Instead of shame, we gave support. What if we treated illness with compassion, not fear? Support, not shame. What if no one had to suffer in silence, or hide behind a mask, or feel like a burden just for being sick? What if every time someone felt alone in their illness, they heard, "You belong. You matter. You are not alone." That's not just a dream. It's a decision we can all make. Right now, together, because ending stigma doesn't start with systems. It starts with us. End the stigma. Stand with the sick. Start the change. You have the power to make someone feel seen, to remind them they're not alone, to turn silence into support. So speak up. Stand with the sick. Be the reason someone feels safe to be themselves. Share this video with someone who needs to hear it. Comment below. Tell us, what does dignity mean to you? Subscribe and join the movement. And don't forget to grab your free anti-stigma toolkit in the description. Full of resources to help you educate, advocate, and lead. Together, we can build a world where being sick doesn't mean being shamed, but being supported. Thanks for watching. I will see you in the next one.